Ask the Messenger's TV show is a TV show that educates, informs, and entertains our viewers on public health issues such as mental illness, suicide, addiction, illness and disease, COVID-19 relief, crime, domestic violence, homelessness, human trafficking, employment opportunities, healthcare, and more. And now, Ask the Messengers.
Today on Ask the Messengers, our guests are Judy Davis, the Substance Use Disorder Director for DWIHN, Detroit-Wayne Integrated Health Network, Westland Fire Chief Darrell, and back with us again this week is the Senior Advisor to the Deputy Mayor for the City of Detroit, Andrea Taverna. They are here today to share information about what each of their organizations are doing to help combat substance use disorders and other addictions that affect the communities they serve. Now let's begin with Judy Davis, the Substance Use Disorder Director for Detroit-Wayne Integrated Health Network. Ask the Messengers begins now. The Detroit-Wayne Integrated Health Network provides services and support to 75,000 people in Wayne County. DWIHN serves people with mental illness, intellectual and developmental disabilities, individuals with substance use disorders, and children with serious emotional disturbances. DWIHN is the largest and most diverse community mental health agency in the state of Michigan, and it is committed to providing the highest quality of integrated health care to those it serves while working alongside with dedicated and compassionate provider network. Welcome to the show. This is Tina Nelson for Ask the Messengers, and right now I'm very happy to have Miss Judy Davis. She is the Substance Use Director for Detroit-Wayne Integrated Health Network, better known as DWIHN. First, before I want to welcome you to the show. Thank you so much for taking time out of your schedule to be here with us today, Miss Judy.
Thank you for having me.
Awesome. So first, I do want to just publicly thank you all for all that you do as it relates to partners, getting the word out as it relates to substance use disorder and many of the addictions that affect our communities. And Ask the Messengers is definitely grateful to be part of the mission to getting that word out for you. We want to thank you for that as well.
And we appreciate your partnership as well.
Thank you. So let's I want to talk about the helpline. So the DWIHN helpline, we've been advertising it here on the show for quite a while. People can see the advertisements on other TV shows for quite a while. But what happens when someone calls that helpline? Let's just say, for example, I got a problem. I'm calling the helpline. What is the process that happens? Can you kind of take us through the steps?
Yeah. And again, thank you for having me and thank you for that question. When a person calls the 800 number, they will encounter what we call a customer service representative. Mm-hmm. And that individual will ask them basic questions such as, basic demographic information. Okay. And also at the end of their discussion, they will also ask them what service are they seeking. And if they indicate that they're seeking SUD services, which is substance use disorder services, they will be referred to a representative, a specialist that specializes in screening for members with SUD issues.
Okay. So once they are screened and they've gone through the process, and let's just say, for example, that person calls, they utilize one of those referral services that they get. Now, is there a cost associated? Is it Medicaid? Is it free? Or how is that determined in case somebody wonders that before they even call? Because the first thing they want to know, okay, I need help. Is it going to cost me? So, right. So how would you explain that situation?
Which always is a guide for me when I call places, like, is it going to cost me and how much? So for DWIHN, we provide services to those members who are either Medicaid or who have no insurance. We receive block grant funds to provide services to those members with no insurance. And even if they have private insurance, such as Blue Cross, Blue Shield have, we also provide services if they're underinsured. For instance, so if we offer services that Blue Cross or HAP may not provide. We provide that service to those members free of charge.
Okay, that's good information because a lot of times, like you said, and like I said, when you call anybody, you want to know, is there a service? Is there a fee or something that I may, get on what's the hidden charge or something?
Absolutely.
So there are none.
There are no hidden costs to the services that we offer. Our services, again, are free. We take the indigent. We take people who are on Medicaid, no insurance.
Okay.
Or again, as I said, if it's private and they're underinsured, I know a lot of private insurance doesn't recover the cost of services for recovery support services. So we still provide that services to those members.
That's valuable information because a lot of times the commercials are good, but this is why we need people like yourself who can really come on and really explain it down to the second grade level where anybody can understand that part. So that's really important to know too. And thank you for that explanation.
Can I also include,
yes,
we
please.
also offer gambling residential services free of charge. And basically our services is for those members who reside in Wayne County. And so for gambling residential services, we received a grant from the state of Michigan where we can provide those services to anyone in the state of Michigan, no matter what type of insurance that individual have or where they reside in the state of Michigan.
That's good to know because a lot of people think addiction is just the hard drugs and alcohol. Now with the rise of gambling, it's amazing. Those numbers are just shooting through the roof as well too. And yes, a lot of people don't look at that as a addiction until they get in trouble. That's when they figure, oh, I gotta have it, right? So when someone goes to the in-house treatment, what's the length of time for treatment in-house now? I know it used to be a certain number of days or a certain number of months. What is the in-house treatment length now for both in-house and if someone's seeking outpatient? What's the length of time for that?
So, yeah, our services that's the old way. The old way, we used to have 30, 60, and 90 days services. However, right now, we don't have a limit on the number of days an individual could stay into services. It is all based on medical necessity, meaning that it is based on the individual diagnosis, the severity of their drugs, and they're also placed in the least restrictive level of care. Okay. So it depends on how the progress that individuals make, how long that individual stay into services.
That's good to know too. So back in the day, you went into the 90, you went into the 30, you went into the 45. So now it's really case by case, of course. Okay, good to know. And I guess it really depends on what facility or what treatment they need at that point too, right?
Yes. And so a person can go into residential services, and once they complete residential services, it's a continuation of services. So we have different levels of care that an individual we just don't say, okay, you completed residential, now you're all better. There's different levels of care an individual can receive, or lower levels of care an individual can receive and continue to stay in sort of what we call a 24-hour residential setting.
Okay. Now, when it comes to alcohol treatment, is that included within the SUD package as well? Because a lot of people still, to this day, they look at drug addiction and alcohol as two separate entities, but they're really the same.
Yeah, I think what you're trying to say is that the legal drug and the illegal drugs.
Right.
Yeah, so we look at a drug as a drug. Yes. So whether it's legal or illegal, some people have take issues with it. So based on the person, whatever they report their drug of choice is, we design a treatment plan around their needs.
Awesome. So before I let you go, Ms. Davis, again, I appreciate everything that DWIHN is doing, and it's wonderful that Ask the Messengers is partnering with you to get that message out. Is there any last thing that you would like for our viewers to know and to understand that might be something that you guys hear on a regular basis that you would just like to clear up for someone?
I just would like for everybody to know that our 800 number is available 24 hours a day, 7 days a week. Our doors are never closed. In addition, I would like to also talk about our naloxone initiative. We have a wonderful naloxone initiative because if you don't know by now, there is an opioid epidemic. And so we're addressing it by offering as free Narcan to as many people as we can in Wayne County. So in the event an individual need the kit, please go to our website at www.dwihn.org. It's www.dwihn.org and request a free kit. We do require that you have some training with that kit, but please, we want to make sure that we get it into as many hands as we can.
Now, that is something, I'm glad you brought that up, and this was a point that I was going to talk about. So recently, I broke a bone in my foot, and I went to the hospital, and they gave me Narco, which is an opiate, right? But this was the first time with that prescription, I got a Narcan kit. And they explain how to use it. It has my name on it. It's like, ooh, okay. And I thought that was the first time, because I have, had the tooth pulled or had the toothache or had the go-to pain medication is Narco, right? But in the past, I never got a Narcan kit. So I'm like, okay, these programs are actually working, because along with my Narco prescription, I got the Narcan kit with the explanation.
And that's great to hear. But yes, we know that now. We used to look at people who are on drugs or who were overdosing as those individuals who looked like they were on their last leg. But we know that people are now who are overdosing, ODing, they look like, the average person, just like you and I.
Yes.
So we want to make sure, again, that we get those kids into as many members' hands as possible.
Awesome. Well, thank you so much for everything that DWIHN does. Here to talk, here to help. Here to talk, here to help.
Yes.
Hey, I know with them. Here to talk. It's working. I'm even hearing it in the voice. Here to talk, here to help.
That's right.
I appreciate you all for definitely being here to talk, here to help, and working with us and us working with you, and showcasing providers that you guys work with and getting that message out, man. It's so important. It's so key. And there's no limit to where that message needs to go, and we got to do that. So I appreciate you so much. And as a director, you got your hands full, lady.
Yes, I do. But we appreciate your partnership as well. So we will continue to work with you and your agency.
We appreciate you so very much. And thank you so much for spending time with us today to explain what DWIHN is, Detroit Wayne Integrated Health Network. Go to their website. The commercial will be coming on right in between this show. So she's already let you know the 800 number is 24/7. Go to the website. Just go get that help. They are there for you, waiting right now as we speak. You may be watching this right now and need to dial that number. So there it is right there on the screen. Don't hesitate. Put it on your refrigerator. Put it in your phone. Put it in your contact list. Put it down as an emergency. You never know. You might need it. So this is Tina Nelson for Ask the Messengers. And Ms. Davis, I thank you so much again for taking time out of your schedule to be with us today and to share what DWIHN is all about and addressing those questions that people may have.
Stay tuned for more of Ask the Messengers.
We are here today with Westland Fire Chief Darrell Stamper. Thank you so much for being on the show. Can you share with our viewers some of your duties and responsibilities as Fire Chief?
Yeah, reporting to the mayor and the city council, I'm in charge of overseeing the operations of the department as well as managing the administrative side of the department. I'm responsible to plan, implement, and design ways to efficiently carry out the fire service. Really to improve the quality of life of our residents and those that may be visiting the community through fire response, emergency medical response, responding to other types of hazards like hazardous materials and technical type rescues, and also community risk reduction efforts such as fire prevention, fire inspections, fire life safety education. In addition to this, I am the emergency manager of the city, which means I'm responsible to make sure that the city itself is prepared to respond to and mitigate both natural and man-made disasters, and that we maintain a continuity of operations in such emergencies so that the city administration can still function.
So we're in the middle of an opioid epidemic. How serious is this epidemic, and what are some of the most common substances that you see being used?
Yeah, the CDC says that there are over 450,000 deaths from opiate abuse, which is obviously pretty serious. About 130 people die each day in the United States from opiate overdoses. I think that's pretty significant. In Michigan, we've seen a tenfold increase in opiate overdoses from 2000 till now. In 2018, there were more people who died from opiate overdose than there were from motor vehicle crashes. So it is pretty significant. We have done some stuff to kind of curb that, but it is a significant event that we need to continue to work towards improving on.
So how has the increase in fentanyl use affected communities around here?
Yeah, in several ways. I think one is their family, friends, and loved ones are affected, obviously, by this. And then, what I would really like to kind of dive into is how then that causes, coping with a loved one being addicted to an opiate, or overdosing or dying from an opiate, how that affects you and your kind of maybe potential to then start using substances to deal with that coping, or really any other kind of medical kind of side effect it has from dealing with that coping in someone. So that's, I think, number one. And then number two is it taxes really kind of an already taxed EMS system, right? There are shortages of both, firefighters, EMS workers, police officers, and nurses in the emergency room. So those systems are already taxed, and this obviously adds to that problem that we have.
So lastly, if there's a viewer out there who's struggling or has a loved one that's struggling, what is the first step that they should take? What advice would you give?
Yeah, so there are a lot of different options. I think one of the best ones is obviously seek help, right? So Michigan.gov has good resources on there of where to start. It's part of our really kind of plan. If we run on someone who has overdosed on an opiate, we leave Narcan behind for their families. So that helps when that comes around again, right, to prevent kind of the long-term effects of an overdose. In addition to that, embedded within our police department is a substance abuse counselor. So when we run on these types of calls, we put in a referral to her. She also sees people in the jails because they have they call a moment of clarity, where they become sober, where they're really kind of open to help. So I think that helps out. Higuera Medical Center in Westland here is a big help for us, and another kind of place people can turn to if they or a loved one is struggling with this type of problem.
I want to thank you again so much for taking the time out of your day. I'm sure it's a busy day to share this vital information with our viewers. So thank you so much.
We'll be right back with more of Ask the Messengers.
We are here today with Senior Advisor to Deputy Mayor Andrea Taverna. Thank you so much for being on our show again. You were on our show last week, but can you remind our viewers about what your duties and responsibilities are as the Senior Advisor to the Deputy Mayor?
Of course. Thank you so much for having me. My responsibilities are helping with policy issues across the Deputy Mayor's portfolio, which includes public safety, public health, and public transportation.
We're in the middle of an opioid epidemic. I was reading up on some facts before I got here, and I see that overdose deaths increased by 41% in 2020, and I think it's at 18% more in 2021. So could you give me a little bit about how serious it is and what you see in your day-to-day?
Absolutely. The opioid epidemic has been a serious public health crisis for well over a decade now. Overdose deaths began rising about 15 years ago and have accelerated even more since the pandemic. In 2022, over 100,000 Americans lost their lives to a drug overdose. Exactly. And when you think about the scale of that, it's tragic. It's hard to wrap your head around. Here in the city of Detroit, we lost an average of one person every single day. And we know that for every person who died, there are many individuals who are still struggling with addiction in the community, and that has a ripple effect on their family and on their neighborhood.
I honestly had no idea that number was so high. That's so sad. So what are some of the common issues you deal with or are fighting concerning the residents of the city of Detroit when it comes to substance abuse?
Absolutely. So the city of Detroit works on all fronts to respond to the opioid overdose crisis and address substance use more generally. First, we work on prevention, so preventing substance use where we can. The health department does a lot of community education about the risk factors that may cause someone to use substances and how to prevent it. We also work on reducing the harm caused by drug use. So that includes work like distributing naloxone, which is a medication that can reverse an opioid overdose. Lastly, we try to help people access treatment. So if they need substance use disorder treatment, we will connect them with it and help them get where they need to go, and then support their recovery over the long term.
Okay, so following that question, what are some of the things that the city of Detroit is doing to fight the crisis?
Absolutely. We are expanding our distribution of naloxone, which is often called Narcan. That's the medication that reverses overdoses. We're also building a new program called a Quick Response Team that's going to help connect people who have survived an opioid overdose or who are struggling with substance use in the community, help connect those individuals with treatment and really get them the care that they need. Last but not least, we're also working to expand recovery housing. So after someone has completed substance use disorder treatment and they come back to the community, they're getting back on their feet, we want to make sure that they have a safe, stable, and recovery-friendly place that they can go.
Are you seeing any positive changes or impact from the programs that you guys have implemented here in the city of Detroit?
We are, very much so. When we take steps like distributing naloxone or other steps to reduce the harm of the opioid epidemic, we know that that is saving lives. More than anything, though, we also know that we're increasing awareness in the community about what a crisis this is and reducing the stigma around substance use so that individuals who are struggling know that they can ask for help and that help is available.
So for someone out there who's struggling, where can they go to look for programs or solutions, or what would be the step that you would tell them to take in order to first get help?
Of course. I would contact DWIHN Integrated Health Network, which helps to coordinate behavioral health care, so mental health care and substance use disorder treatment here in the city of Detroit and across Wayne County. They do operate a 24/7 phone line, so if you need help, you can call that line and get connected immediately.
Well, that concludes this week's episode of Ask the Messengers. We also invite you to follow us on Facebook, Instagram, Twitter, and to subscribe to our YouTube channel. If you would like to help support our show, please feel free to make a donation of any kind by visiting our show website, www.askthemessengers.org. If you prefer to mail donations, please make check or money order payable to Ask the Messengers TV show and send it to 18400 Schaefer Highway, Detroit, Michigan 48235.
We do these shows to educate our viewers on what to do if they experience this themselves or with a loved one. For anyone out there dealing with this crisis, whether it's yourself or someone you love, there is hope for you and there are resources. Make today the day. Thank you so much for watching, and we'll see you on the next episode.
Ask the Messengers is the program that deals with things that help you. Thank you for watching.